what we've been seeing for the last 20 years is a change in our practice, in that we've gone largely from a lot of acute problems like ear infections and throat infections to chronic disease management. So we take care of increasingly high numbers of children who suffer from asthma, obesity, and a lot of mental health problems like attention deficit, depression, anxiety. So these kinds of chronic diseases are well suited to a prescription for outdoors. So we write prescriptions that are not written on the same prescription paper that I would write a medicine on, but it's a concept. It's the same concept. So I'm prescribing something, and we do that every day as doctors. We do that. We prescribe things every day, and a lot of what we prescribe is not a medicine, which needs to be done on an official prescription, but rather through a dialogue between myself and the patient. So I might recommend, for example, for somebody to drink 5 glasses of water a day. I don't need to write a prescription for that per se. I also recommend for children to read books at least once a day with their parents, for the parents to read to them if they're too small to read. And we also do the same thing for nature. Now with nature, fortunately, we have a program called DC Park RX, or DC Park Prescription, and that entails writing a prescription that we use from the National Environmental Education Foundation. But we've also created a very rich, robust database, searchable database of green space or parks in DC. And so we can look at the zip code of the patient and quickly put that into a searchable database and pull up all the parks in that patient's zip code and see what kinds of parks are there, activities are there for them, and print the ones we think are the most suitable for that patient's needs, and then review them with the patient, and that's what we're prescribing. We're prescribing a park in that sense. So far, we've had a very positive response. I haven't had any eye-rolling or deep sighs about this. We've seen a lot of encouragement from the families by listening to them tell us the stories of their experience in parks, and also listening to the children tell us about what they did at the park the last time they went. So that's very encouraging for us. We see at least an anecdotal change in behavior and attitude toward parks.